Hi everyone, it's Christina here from BeSpoke Aesthetics in beautiful West Palm Beach, Florida. And I have the other owner of BeSpoke Aesthetics, AKA my amazing husband, Joe, who is my model today for non-invasive skin tightening with a device called Sofwave. Sofwave is one of our favorites here at BeSpoke Aesthetics, and the reason why is because it really does the job for a treatment to lift and tighten several different areas on the body. In this case, we are going to be treating Joe's neck area right here where he has some laxity. We can notice that on the left side, there's more laxity here than the right side. So we want to get rid of that. And this whole area here has been numbing for the last, let's say, 30 minutes or so. It is a treatment that delivers ultrasound energy through heat, through these ultrasound waves that get down to the muscle to tighten and therefore lift. And it's a treatment that patients love because they literally can do it in the morning, in the afternoon, and be out and about that night or the next day because there's no bruising, no downtime, no swelling, so it's a perfect treatment. Now, who's a great candidate for it? It's really anybody who is looking to do any sort of skin tightening, whether that's on the face, a brow lift to lift the lids underneath the eyes to improve skin texture and to tighten the skin underneath the eyes. In this case, the lower face, the neck. So we also do it on the arms, the legs for that crepey skin texture. But in this case, we're going to be treating the lower face, and we're going to be doing in a pretty quick treatment because it doesn't take that long, and let's do it. So everyone wants to know, what does it feel like? So for the first couple of seconds, it's going to feel like nothing. And then the last 2 seconds of the treatment, so 4 seconds of mostly nothing, and then the last 2 seconds, you will feel heat. Sometimes that heat in certain areas is more pronounced than others. I always give everybody these little stress grippers. I think we're gonna be just fine. So this is the hand piece, and we're gonna start. We're gonna start right here. What do you think?
Fine.
Now, it doesn't matter, men and women are both candidates for this treatment. It's a treatment that is pretty repetitive, so we do this for a set amount of pulses. So far, so good?
Yeah, I just feel a little warmth and tingling for a couple of seconds, and then it's basically over.
Oh, good. The other thing too that I should mention about this treatment is that you will see results after the first session, but it gets cumulatively better over the course of 3 months. So by that 3-month mark is when we should notice the most in terms of the outcome. Now, one of the things also is that people want to know, will I need multiple treatments? And so I tell patients, we will see what the results look like after 6 months to determine if you may need a treatment at the 6-month mark. Some patients only need yearly maintenance. For something that's a stubborn area, that needs a little bit more, that has more laxity than, let's say, the average for their age group, yeah, you probably will need another treatment at that 6-month mark. But there are a lot of patients that do very well with this, and I would say on average, they're getting a treatment every 8 to 12 months. Everything that I do here at the practice is non-invasive, and it's not surgery, obviously. And so because of that, you need to have maintenance, whether it's with your neurotox treatment, whether it's with your HA injections, skin tightening, all of it requires maintenance. Is going to get better as time goes on. So we'll take, we did photos before we started, but we'll take follow-up photos in 6 weeks, and then we'll do follow-up photos 6 weeks after that. All right, so we just finished. It was pretty quick, right?
Quick, easy.
Painful or painless?
No, just the pulse, the way that you feel it is, it's applied to the skin, and then the heat kind of crescendos, and it'll reach like this max little heat where it's like a tingling, and then it's over. The pulse is over. It's really not that painful at all.
That's a good way to explain it.
Yeah.
Wow, 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 wow. So here's the thing, is that this is not, like I said earlier, the final result, but it does look great. And our goal is that it will continue to improve over the next 4 to 6 to 8 to 12 weeks. So typically what I do is I have patients come in 6 weeks from their initial treatment. We do follow-up photos. I usually will say, we're not there yet. We still have another 6 weeks to go until we see the final result. And then at that 12-week mark, we'll take another set of photos and then of course compare. Now, as you can see, I just took off the ultrasound gel. He has no redness, no swelling, no bruising. So you can put makeup on, you could wash your face, use your skincare products, pretty much go about your day, and there's really no significant aftercare. We just tell patients, avoid any Motrin or Tylenol for 24 hours. There is an inflammatory response that happens. We don't want to reduce that inflammatory response. That's how we get the maximum lift and tightening from that inflammatory response that the device creates. We tell patients, no steam room, no sauna, no gym for 24 hours. Typically, patients are like, oh, okay, no problem. But, using medical grade skincare products and then just making sure that you come back for your follow-ups so that we can take those photos. And then, like I said, we will discuss when we get to that 6 to 8 month mark, comparing the photos and talking to the patient. I'll say, how do you love your results? What are you noticing? And then we'll come up with a game plan if we do need to do maintenance at that point, or if we have to, we just wait until that 1 year mark. It's a great treatment. Really, anybody is a great candidate for it up until, I would say, early 60s, male or female. I will say that my male patients typically, unfortunately, ladies, they typically notice a quicker onset of the results. Women still do really well with this, but for whatever reason, I've just noticed that my male patients have noticed a quicker onset of seeing those changes happen prior to the 12-week mark. But this was a great treatment. I'm really excited to see this because it already looks great, and it's just going to continue getting better from there. Thank you for being my patient.
No problem.